So COVID-19, I think, has taught us that health is the basis of wealth. And in a post-corona virus world, healthcare would emerge as the major focal point of attention for many nations across the world. In India, we have an overburdened and underfinanced public healthcare system, high cost of private healthcare, and high reliance on out-of-pocket expenditure, making healthcare inadequately accessible to a majority of Indians. The pandemic has been an eye-opener for most people, reinstating why a health insurance is indispensable at all times. The rich segment, I think you will agree, the rich segment of our population can afford the cost of medical treatment anywhere. And below the poverty line segment is now being fortunately covered by our government under Ayushman Bharat scheme, and there are other state government healthcare schemes. The most vulnerable section post COVID-19 will be the large middle segment comprising of approximately 500 to 600 million people, as organizations are looking to cut costs and individual disposable incomes might go down substantially. Most of this segment is not poor right now, but they might end up spending all their savings or and into a debt trap and will fall between the cracks. So I think very important for today, we will discuss on how can we protect this vulnerable segment, often ignored segment of our society, by making health insurance mandatory. It is our privilege to introduce our esteemed panelist, Mr. Annaswamy Vaidheesh. He is the president of Organization of Pharmaceutical Producer of India, chairman of Healthcare Committee of CII, and on board of UK India Business Council. He is the former vice president and managing director of GlaxoSmithKline Pharmaceutical, and he has over 3 decades of experience in healthcare at FMCG domain. He was recognized as one of the most influential leaders of Asia by Economic Times at the Asian Business Leaders Conclave. And I still remember in 1999, Mr. Vaidheesh was very passionate about health insurance. And most of us who are either participants or panelists, we were not aware of this. Mr. Vaidheesh, I still remember, wanted to ensure that we have a universal health coverage in our country. We should have a higher penetration of health insurance. And I think last 20 years, I have seen him passionately working towards achieving this goal. So welcome, Mr. Vaidheesh. And my question to you is that how can we all stakeholders collaborate to make health insurance becoming a mandatory in this country a sustainable reality? Over to you, Mr. Vaidheesh.
Good afternoon, Gaurav. So first and foremost, my thanks to all the panelists who agreed to be part of this very important webinar, and also to all those who are logged in. I know that I got to know from organizers and Gaurav that there is a big interest for this subject, and I know that many people have logged in. So I'm quite sure that you will find it very valuable listening to all the experts on the panel. So I won't dwell too much on what is health insurance and why it is important and why it's mandatory. So I will create the context for the same. As many of you know that India is very unique in their way in which we have got our healthcare system itself. Unlike in rest of the world or most of the world, India is the only country where almost 70% of the healthcare is out of pocket. where people pay on their own. It's like how you buy or a retail buy any other product. People buy healthcare in this country. Now, I'm not sure whether it was by design, but I think it got evolved as we know it for a period of time. And we stuck to the whole old healthcare system, which was primarily dependent on what I call it as a breakdown healthcare, and maybe the legacy of the British system, where we depended on the old primary healthcare, PHCs, CHCs, district headquarter hospital, and government hospitals, were taking care of the people who were in need of an acute care. And at a point of time, when people started living longer as compared to what we were in 1947, where average longevity was only 45, and today the average longevity of an average Indian is about 68. Now, quite obviously, when you start living longer with good intervention of healthcare happening at various point of time, from acute care, the healthcare started moving towards, like any other part of the world, it started moving towards a non-communicable disease. Basically, it's coronary heart diseases or renal failures or liver and those kind of stuff, which are, and then predominantly also induced by diabetes. The reason why it's important for us to understand the healthcare, which is primarily driven by a non-communicable disease or a chronic, are pretty expensive. If you have to have your insulin on a daily basis, and each insulin on an average cost is about 50 rupees to 75 rupees, and if you have to spend the money on a daily basis for 365 days, it's pretty expensive for people, particularly those who are above the age of 45 and 46, and particularly people above the age of 55 and 60, where you tend to be on income side of basically you are retired or you don't have an additional income to pay for. So you are talking about an healthcare where the income need, where the income is relatively less, but the expenses start climbing up, going through the roof. Whereas in a critical, acute care driven healthcare, your average expenses are not as significant as what it used to be. Only in the later part of 1980s, where the government of India relaxed the norm of healthcare, where we started moving from
Hey, Sanjay.
where we moved from private healthcare, public healthcare to private healthcare. Is anybody or?
I request everybody else to please mute so that the person who's speaking can talk. Manish, I think.
So when the private healthcare started climbing up, unlike in other parts of the world, the healthcare is not integrated in India, where the healthcare system is driven by what I call it as the 6 P's of healthcare: payers, providers, policymakers, physicians, policymakers, and the playmakers like pharma companies, devices, diagnostic companies. Where in many of the countries where all of them are integrated by clearly defining what a patient care pathway is. Whereas in India, we haven't integrated the healthcare, particularly with the non-communicable disease going up, where each individual component of the healthcare ecosystem has been playing independently, unfortunately, to many times at cross purpose, where a provider is looking at to maximize their interest in the healthcare ecosystem, maybe at the cost of a payer, maybe at the cost of a physician, maybe at the cost of a patient, or sometimes even at the cost of playmakers. And similarly, a payer tries to maximize their interest of trying to maximize or reduce the outflow, and similarly a pharma company or a physicians. Each one of them were trying to maximize their interest in the ecosystem without having to speak to each other. Now, this has caused a significant pressure in the system, wherein today a patient is not necessarily not knowing what does it take for him to get a treatment done. So I have to bring it to the context of a time where this particular topic is being discussed. Say, for example, in time like COVID, where today people are under pressure to figure out how do I fund my healthcare suddenly when I'm not prepared for this pandemic. Now, I'm not saying that the only way is to find out some health insurance companies to solve the problem, but actually this brings to the reality of the way in which the healthcare system operates in country, where people have to sell many of their properties or belonging to get their healthcare done, which in my opinion is very unacceptable in a very civilized and developed markets. So it very clearly, it's time for us to start looking at how do we help a patient who is the key player in this whole healthcare system for which the healthcare system is serving. Everybody has to serve the patient. It's important that we as a community has to figure out how do we put money in the hands of the patient or a person who deserves the healthcare without having to, somebody has to pay out of the pocket, not knowing the level of weight that's going to have on their disposable income. In many countries, there are various methods in which the healthcare is being supported. One, fundamentally through what we call it the government insurance schemes. There are some countries follow something called the healthcare financing programs like health savings account, or there are multiple models in which the patient knows how to get a financing done apart from paying out of the pocket. As far as the health insurance is concerned in India, it's underdeveloped. And I still remember the time when Mr. Shekhar Sampath is here, or the people who know Siraj, and we started talking about why a patient should struggle to find money to pay for the healthcare. We need to find a way of what we call it as a leveraging the power of billion. Way back in 2005 and 6, we started bringing this whole concept of health insurance as a good alternative for healthcare financing. Quite obviously, it's not as simple as what we thought, because when you have to develop health insurance in this country, there are various systems that has to be in place. As I told you, the integration has to happen. There has to be a trust that has to build amongst the various stakeholders, and one should not try to maximize other people's interest. So we did a lot of work in this journey. I still remember in 2005, the healthcare premium, health insurance premium was somewhere around 3,000 crore. And we knew that 3,000 crore is nothing compared to what it can do to the, and also the penetration was hardly 1 or 2%. And there's a lot of water has flown. Today we are talking about something like a 30 or 35,000 crore as a premium. But the opportunity is for more than 100,000, 1 lakh, 100,000 crore could be the minimum premium that this country should pay to take care of everybody's interest in this country at a very insignificant premium that they have to pay for. There are various models that have been proposed, and Ayushman Bharat is one such example which was born out of various state health insurance schemes which we all were part of in terms of driving that and bringing it to the country. It's an attempt to integrate healthcare and at the same time bringing one financing mechanism to make sure that underprivileged class gets a chance to get a good healthcare. However, there is one piece of the society that missed out. That's a middle class population. Still, a middle class population is the one, what we call it as a missing middle, is the one which get missed out, where even one episode of bad episode of healthcare happens, they tend to almost go below poverty line because of the fact that middle class population has a very high level of aspiration in life. Unfortunately, they are the one who get sandwiched between the poor people and the so-called the people who can afford. And one of the attempts that we are saying is that how do we make sure this missing middle get what it takes to pay for the healthcare without having to lose whatever wealth that they have created. And so one of the thoughts that we've been talking about is that unlike many other countries, is there an opportunity to make healthcare insurance as a mandatory mechanism like what we do for taking care of the people's later part of their life to the concept of provident fund? Or there are various schemes that we have for people who become elderly, then we don't want them to be on the roads. There are various schemes that have been the government as well as a public that are available, but it comes down to health, which is short of financial hole for many of the middle class people. It may be a good idea that we should look at health insurance as a mandatory mechanism where they tend to pay the premium early part of their life so that their later part of the life is taken care, and through a various financing subsidies, through income tax relief, by which and where average middle class family is free of the worry about what will happen to my family even if there is a one episode of a healthcare happens. Now the word mandatory may be misleading, but the fact of the matter is that when you can make a third-party insurance mandatory for an automobile, or when you can make PF as mandatory for every employee, or there are a lot of similar kind of stuff that are being mandatory, I think it may not be a good idea to look at health insurance as mandatory for every citizen of this country. But obviously, when I said every large portion of the people are the middle class, which is the missing middle, and help them to focus on something better in life rather than worrying about what will happen if me or my family member become sick and how do I take care of them. And I know that Government of India talks about preventive healthcare, promotion, and a lot of other programs in place. I'm quite sure that some of the panelists will be addressing that in their during their part of their presentation. But the whole idea of today evening is to be provocative and to make people to start getting into the conversation of health insurance as a very important element in every family, rather than waiting for some event to happen and running pillar to post to find the finance to take care of the healthcare. Because in my opinion, when a patient is sick, they are emotionally compromised, and at that point of time, physiologically and emotionally compromised. At that time, somebody to expect them to think about where do I go for money is a bad idea. That's not a very good form of a civilized world. So we thought it would be a good idea to have a conversation as the experts. I know there are pros and cons of making health insurance mandatory. But however, it's a good idea to kickstart this conversation. I know in various forums people have talked about it. And my thanks to Honorable the Chairman of IRDA, who has also taken a lot of interest in coming up with innovative products, and he has given permission to various insurance companies to launch. But I do believe there is a big scope. to make health insurance as mandatory so that we as a developing country and having a semblance of being developed should have a robust health financing mechanism in place so that we continue to grow as a prosperous nation and as a healthy nation. So I'm really looking forward to a very intellectual conversation from all the panel members, and you all enjoy listening to most of them. Thank you very much, and thanks Gaurav for giving me an opportunity to kickstart this session.
Thanks a lot, Mr. Vaidheesh. I think, as usual, very lot of valuable insights, and I particularly liked about your thoughts on having a healthcare saving fund. I think which is very, very important and critical because we need to have various financial mechanisms along with the health insurance to ensure that this middle segment, which is the most vulnerable right now, can get adequate care.